I'm going to be giving out medication to a patient. The first thing I would do is make sure I have all the necessary information, such as my physician's orders, the MAR, and the nursing cardex. What I would do is I would go to the physician's orders, I would see if there's any new orders, and I would check the standing orders. This is where I would check if there was any discrepancies between the MAR and the nursing cardex to see which is correct. And if I do see any strange orders that are out of the blue or seem to be incorrect for the patient, I would be responsible to contact the physician. Next, what I would do is I would take my MAR and my nursing cardex, and I would compare that medication order. And they have to match up 100%. So I see that there's no discrepancies. Perfect. What I want to make sure to do, right now this is the first medication check, I want to check for the patient's 6 rights. The right patient, the right dosage, the right route, the right drug, the right time, and the correct documentation. So now what I would do is I would take my MAR and nursing cardex to the med room or where they keep the Pyxis. And this is my Pyxis. And this is where they will keep the medication. So what I want to do is I want to make sure I have my MAR and nursing cardex, and usually there's a sheet or on the, if it's computer, it'll tell you which drawer the medication will be in. Okay, so I look at the chart on the side, and I see that it's in the second drawer. So I want to double check each medication I take out, that is the 6 rights. Right patient, right dosage, right route, right drug, right time, and right documentation. Okay, so I'll take out medication. And here's where I would do any drug calculations. For this, I do not have any to do, nor do I have any drugs to split. And if I did need to do a splitting of a drug, I would make sure that they can be split. For example, extended release and coated medications cannot be split. So for this example, all of my medications are correct, and I am ready to move on to my patient's room. I would make sure that I'd only do one patient at a time because that would be a cause for error. And this is my patient's bedside table. So I would knock and introduce myself. Hi Kylie, my name is Mercedes. I'll be your nurse today. How are you doing today?
I'm doing well.
Good.
How are you?
I'm good, thank you. I'm here to give you your 9 o'clock medication. So what I have for you is heparin, aspirin, and Lasix. And then I would check her wristband. Cool. Can I have you say your name and date of birth for me?
Kylie Ingebrigtsen, October 18th, 1993.
Perfect. And I would want to make sure to know all my patient's information before I went in the room, and I would want to double check what she said with her wristband and the nursing cardex. This is the 3rd medication check. Before I would go into a patient room, I would make sure to know when the last time their vitals were taken, because some medications need vitals taken before you administer them. I would make sure that I know any lab values that are abnormal. In this case, all vitals are normal. They were taken 2 hours prior, and all lab values are normal. I would also make sure that I know why she's there, how she transfers, activities, diet, and if she has any allergies. So now I would go and I would get my med cup. Would you, you have 3 medications today. Would you like to take them together or separate?
Separate, please.
Okay. We're going to start out with heparin. And what that is a blood thinner. There you go. And I would make sure to undo the packet and then put it in the med cup and then give the med cup to the patient. Make sure she has enough water to drink. And for this example, we're using Starburst, so make sure it gets down properly. And if she's in the laying position, I would put the head of the bed up, but because she is able to sit up by herself, I would then, advise her to sit up so that she can swallow without hazard choking. Get down all right? Okay. Next, we're going to do aspirin. And this is to prevent blood clots. And prior to giving out these medications, I would make sure that I would sign off for these medications, make sure that they're documented, the time and date that I took them out. If in some cases they'll have a sheet that I signed, a shift verification, I would make sure to sign that. If it's on the computer, I would make sure to electronically do it. Did that go down okay?
Yep, that was good.
Okay. And lastly, we have Lasix. Okay. This is a diuretic. It's essentially a water pill that helps with getting rid of any excess fluids. So that will help with the swelling in your legs. So I also brought in your PRN medication, which is as needed, and she is able to get tramadol for pain as needed for pain every 3 hours. And I looked before I left, and it has been just over 3 hours since she was last given it. So I brought it in just in case she wants it. So now I will ask her, are you in any pain?
Yeah, a little bit.
On a scale of 1 to 10, what do you think it would?
About a 6.
Okay, so I think that in order to keep your pain on a minimum, I would suggest taking this medication, but that is up to you. Would you like to take the tramadol for pain?
I would.
Okay, then I would. I would open up the tramadol, make sure she has that. And I double check, all of them went down okay?
Yep, we're good.
Do you have any questions about the medications I gave you?
No, not right now.
Okay, if you do, let me know. At this point in time, if you need anything, let me know. I would make sure that she was comfortable in a safe position, that her call light was within reach. She doesn't need anything at this time, so I'll assure her that I'll be back in an hour for my hourly rounding. If I have any assessments I need to perform, I could do that now. I would make sure that as soon as I give the medication to document that I have given it, ensuring the patient's 6 rights, make sure to answer any questions, leaving her in a safe, comfortable position. And I would be reassessing for pain and negative signs in less than an hour, but over 30 minutes. Okay, Kylie, thank you so much. Is there anything else I can do before I leave?
No, I think I'm okay.
Okay, thank you so much.
Thank you.
And then I would take all the information, because it is personal information. You wouldn't want to just leave it laying around in any trash. I would make sure to dispose it properly. Make sure that she is in her room safe and sound, and thank you.